Hello and welcome to Focused FM TV's Carbon Reduction programme. I'm joined now by David Pencheon, who's the Director of the NHS Sustainable Development Unit. David, thanks for joining us.
Hello.
So firstly, David, the NHS Sustainable Development Unit has recently issued an update to the NHS Carbon Reduction Strategy. Why have you released this publication now and what does it address?
We've released an update because there are new data and we want to introduce techniques to show not just what the scale of the challenge is, but what the scale and opportunities are in addressing it. So we can say this particular intervention leads to this amount of benefit, both for saving money and saving carbon.
And the NHS carbon footprint has risen by 3 million tonnes since the last footprint was calculated. Why is this?
Any rise is a cause for concern because the aim is to flatten it and then start reducing it in line with government targets. The reason that the rise looks probably bigger than it is because we've had to change the way we measure the carbon impact of the NHS to make it carbon dioxide equivalence, which is compatible with national and international standards.
Now, with the NHS facing competing priorities, sustainability may be perceived as a distraction to a trust's core business. But is there a link between sustainability and other priorities like the QIP agenda?
There's absolutely a link between sustainability and the quality of the services we deliver, and sustainability is increasingly being seen as a core and corporate part of quality because it helps address many of the other issues we're trying to address, like care closer to home, better use of ICT, reducing the over-reliance on pharmaceuticals. So there are many ways in which taking a sustainable approach helps deliver many of the other things we've been trying to deliver, probably the most important being care closer to home.
Okay, and from the findings in your update, what are the carbon reduction measures that can bring about the biggest emission reductions and cost savings?
Well, initially, the biggest reductions come from doing the core business much more efficiently, and that's about really keeping a very close eye on energy prices and where energy is being used. The importance of this is that the government have just introduced the carbon reduction commitment, which will involve for most large NHS organisations taxes. And the earlier the NHS and all its constituent organisations take action, like micrometering, which most estates and facilities and energy managers will understand, the more money there is to be saved and earned back from the taxes we'll have to pay.
Now tell us about the Procuring for Carbon Reduction Toolkit. How can this help trusts to tackle the massive carbon impact of procurement?
The Procurement for Carbon Reduction Toolkit brings together expertise, guidance and case studies whereby those people responsible for buying in the health service can get the best possible deal whilst making their hospital trust a really core part of delivering a sustainable health service by reducing the cost, improving the quality of the services and goods they buy, and improving experience for patients.
Now, healthcare estates and facilities professionals have a vital role to play in carbon reduction. What's your message to this key group of professionals?
Well, the message for this key group of professionals is such they've been doing a lot of work in the basic good management of healthcare estates, keeping energy prices down, managing car parking, all the really gritty things. And what we really need to do is to make sure that the best that's being done is universal and consistent and systematic across the NHS. The second challenge is taking those attitudes in estates managers and instilling them in other parts of the health service, like the clinical pathways, like the whole way we've got the potential to redesign healthcare, which is better, more convenient, safer, higher quality for the patient, and promote sustainability and carbon reduction.
And finally, David, can you provide a good example where healthcare facilities teams have led a successful carbon reduction initiative?
There are many examples. Two in particular have struck me recently. One is University College Hospital London, which has done a huge amount, not only to deliver better, more cost-effective healthcare in their multiple sites in London, but have actually made it a core and corporate part of the whole ethos of managing one of the largest hospitals in the country. The other hospital is the delivery of mental health care services around Darlington, where sustainability is a core part of the quality of that services, signed up to by the chair and the chief executive with real leadership drive, which is saving money and improving patient care and making it a more sustainable health service.
David Pencheon, thank you very much.
You're very welcome.